My name's Henry Sharp. I'm a consultant ENT surgeon. I was appointed in East Kent hospitals in 2004 with a particular interest in rhinology, that is surgery of the nose and sinuses, and in rhinoplasty, which is operations to change the shape of the nose, and that can be either from a cosmetic or a functional point of view. So rhinoplasty is an operation to change the shape of the nose, and that can be done either for cosmetic reasons or for functional reasons. In other words, because the nose does not work properly and you can't breathe very well through your nose. And often it's a combination of the two things. Most of the patients that come to see me, however, will want some sort of change in the shape of their nose. And that's often to make the nose smaller in shape and size, occasionally to make the nose bigger or to fill in little holes or little areas in the nose that they don't like. Or sometimes the nose is not straight, so it might need straightening from that point of view, particularly after trauma to the nose. And occasionally there is some abnormalities and shape problems with the nasal tip, which also can be addressed. And a change in the shape of the nostrils is often associated with that. So rhinoplasty covers the whole aspects of the nose, both from shape and function. Results that you can expect really starts at the beginning of the journey, as I like to call it, when you come to see me in outpatients. So patients will come to see me often after recommendation from either other patients that I've operated on or their GPs or through my website, and they will have fairly specific ideas about what they want changing with their nose. So the journey really starts with us talking about what they want changing with their nose and continues throughout the outpatient consultation with a history of their general health and their mental health as well, which may be affected by the issues with their nose. I will then examine the nose and we'll make a judgment as to what is possible and not possible maybe sometimes to change with the shape. So we achieve a consensus during the outpatient appointment of what we can achieve with the results. I then would send people away for medical photographs, and this allows a period of reflection after the first visit as to what we can achieve with the surgery before they then come back to have the photographs looked at by me and by themselves, both in printed form and also on my laptop. My laptop allows me to change the configuration of the nose to show potentially what the nose would look like after the operation. And both patients and myself find this very helpful in that it allows some degree of planning in real time, as it were. I'm then able to show you pictures from a database of photographs that I have of other patients that have undergone rhinoplasty, and we can make a reasoned plan in the light of that consultation. So usually people will be aware of what the nose will look like afterwards, after 2 consultations, but I never will stop it there, and if people wish to come and see me again at any stage before their surgery, I'm always happy to do that. So rhinoplasty is generally performed under general anaesthetic, so as a day case procedure. So patients will come in the morning, they will be put to sleep, have their surgery and go home the same day. The procedure itself can be performed by an open or a closed approach. And by that I mean an open approach is where there's a little cut underneath the nostrils here in the middle here that allows access to the nasal tip, whereas a closed approach is done entirely up the nostrils, so there's no external cuts on the nose at all. And generally, I do a combination of the two, depending on your individual needs and requirements with the surgery. The surgery then involves generally, as I said previously, most people will have some degree of material that they wish removing from the nose, a so-called reduction rhinoplasty. So there will be various bony and cartilaginous components of the nose that I will remove in order to make the nose look smaller. Occasionally, the reverse will happen and I will put in little grafts or implants into the nose, usually taken from your own cartilage of your nasal septum or occasionally from your ear as your own material that is put into the nose. When these changes are made, usually the nasal bones will have to be gently rebroken and reset in the right configuration. So there will be slight bruising afterwards, particularly around the eyes, and you will get slight black eyes afterwards. At the end of the surgery, I hardly ever use nasal packing, and all the stitches inside the nose and on the outside, if there is a cut underneath the nose there, will be dissolvable. You will then have a plaster of Paris splint on the nose, just on the outside of the nose here, with some flesh-coloured tape, making it virtually invisible from a distance, and that will stay on for a week. On discharge from the hospital, you will get an appointment to see me again in 1 week's time for removal of the plaster of Paris splint in outpatients, which is a very simple and easy thing to do. Following the surgery, you will generally need 2 weeks off work to recuperate. It is minimally painful. Paracetamol is usually enough for any patient that has this type of surgery, but you will need 2 weeks off work generally to relax and to recuperate, and by that stage the bruising will have virtually completely gone. Well, the answer to that, yes, I can help. But the key to that is correct and accurate diagnosis, and that is the real thing that unfortunately your GP is unable to offer you in general practice, mainly due to lack of the right equipment. Here at the One Hospital we have all the endoscopic equipment, nursing staff support to be able to examine your nose in great detail. So that's the main thing, is really accurate diagnosis of what is going on. So what can be causing the blockage in your nose is usually due to a structural problem or occasionally problem with the nasal lining. And particularly if you have been to see your GP before you come to see me, they will often have started you on nasal sprays to try and shrink the nasal lining down a bit. That's a very reasonable precaution to start with to see if that helps, and in a proportion of patients it will. But in often what there is concurrently is a structural problem in the nose that needs addressing. Most commonly that involves a problem with your nasal septum, which is the partition between the two sides, and that will be bent either one way or the other, which is blocking your nose. That is readily correctable with an operation called septoplasty, which is purely an operation to straighten the partition, not usually an operation that involves concurrent rhinoplasty. There is also often a problem with your inferior turbinates. Now, the turbinates are a normal part of the anatomy inside the nose, but can become very swollen, and that swelling may not respond to the intranasal steroid sprays that I've mentioned previously. So there is surgery that I can perform to reduce the size of the inferior turbinates, and that can be either performed independently or in addition to an operation to straighten your nasal partition, the septoplasty. So there is various options on the table, both medical and surgical, but once you've been accurately diagnosed, and I can't emphasize that enough, it's the diagnosis of the problem that is the issue. One thing I should mention, the other thing that you may have with relation to a blockage of the nose is nasal polyps. And these are a benign inflammatory condition of the nasal and sinus lining, which sometimes do respond to intranasal steroids, but again, if they don't, there is surgery called functional endoscopic sinus surgery, which may well be applicable in these particular instances. So these are the sorts of surgery that I would be suggesting for you, although I must emphasize that surgery is not always necessary. Diagnosis is key. Surgery is the last resort in the situation, so the accurate diagnosis of the situation is the most important thing. Certainly, before considering surgery, there would be medical options available, and that usually involves some intranasal steroid sprays or drops to try and shrink the nasal lining down. If, however, there is a structural problem with the nose, then surgery may be an option, both by reference to a septoplasty to straighten the partition, possibly turbinate reduction surgery to reduce the size of the inferior turbinates. Sometimes, as I've mentioned previously as well, a combination of septoplasty and rhinoplasty if the shape of the nose and the internal structure of the nose are both at fault. So there is a whole selection of treatments available. The key is diagnosis. So my advice to you would be, if you have a problem with breathing through the nose, problem with the structure of your nose, or a combination of the two of them, then I would be very happy to see you, to give you the benefit of my advice, the benefit of a full and complete examination, to give you the full range of options that are available for the treatment of either a functional problem with your nose or a cosmetic problem with your nose.